fajnie rozmiary. Tak postawi, ja ze zaki po słonku,
Hi guys, it's day 7 of my recovery, and it's the first day I've been able to speak. I've been so poorly. I just wanted to come on and say I think I'm over the worst, and hopefully it will just get better from here on out. Yes, hoping. Hi guys, I just wanted to come on and say that I am on day 9 post-op, and I've been talking pretty much all day. It's 8 o'clock in the evening now, and I'm going to rest my voice, no more talking, because it's starting to really hurt. Mornings and night is still particularly very awful for me. Didn't film anything yesterday, felt too bad. Didn't sleep all last night. Was up all night long in pain, hoping for a better night's sleep. Just took my meds. I just want it to be over. So done with feeling this discomfort in my throat, my ears. But yeah, I'll see if I can record anything. I mean, it's just the same stuff I'm recording. But I will, when I'm fully recovered, I will put a video together describing my experience in detail, day by day, what it was like. I will make notes. I just haven't been able to record because it's just been too painful. But I will make notes, and I will make a proper informative video when I'm able to actually speak clearer and louder for you to hear me. So yeah, hope you all have a good night, guys, and I'll check in with you later. Hi guys, so I'm back, looking a little bit better, I think, feeling a little bit better. So I just want to make a video, a proper video, because I didn't get a chance to vlog day by day just because it was just so painful. So I'm gonna make this video and kind of just give a summary of what happened, what my personal experience was day by day. And yeah, I'm attached to my water bottle at all times. I'm drinking constantly just to kind of ease the discomfort, keep my throat open, and yeah, it just feels really nice ice water. So let's just jump to the actual operation day. The actual operation is quite quick. It's, I believe like 15 to 20 minutes. It could even be quicker than that in some patients. So I went to my local hospital. I didn't have to wait that long. I went straight into the ward. I met with my surgeon and my anaesthetist after about 1 hour of being in the ward. And after I met with them, obviously the surgeon discussed what was going to happen, a little bit about the risks and complications. I'd already done so much research prior, so he didn't tell me anything that I didn't already know or wasn't already prepared for, so nothing was like a shock or anything. And then I met with my anaesthetist, took some of my details down, and then they came for me probably around half an hour after that. So all in all, I think I waited around 2 hours from the time to getting to the hospital to actually having my operation, which wasn't bad because other operations I've had, the anticipation of waiting, I've waited before like up to 4 hours, and the anticipation actually gets you more than the actual operation because you just start to kind of panic kind of sets in, you know, if you wait too long. So yeah, obviously went down, had the operation, then came around to excruciating throat pain, which was a little bit of a shock because obviously you're so drowsy and so out of it, you're not in this world when you're waking up from anaesthetic, and then to wake up with the worst sore throat of your life, it's a little bit traumatic. So yeah, obviously they give you loads of pain meds. I got codeine, paracetamol, ibuprofen, and then just got told to drink tons of water. So I was drinking lots of ice water. And then by the time my husband came to pick me up, I was starting to feel very, very nauseous. So in my other operations, I haven't felt nauseous at all after. I don't get nausea after anesthesia because normally they give me anti-sickness medication. For some reason, this time they didn't give me any anti-sickness medication, which is a little bit strange. But they kept saying to me, oh, it's better if you vomit. Like on this occasion, it's better if you vomit than if you try and hold it in, or if we try and give you anti-sickness. I'm not sure why that is. Maybe because there is a small amount of blood that you swallow. I'm not sure, that needs to come up, I don't know. But by the time my husband came, I was standing because, so they called my husband in, and then the nurse wanted to give my husband like a whole talk of, you know, what to look out for and all the medication that I would need to take, when I would need to take it, antibiotics, etc, etc. As I was standing there with my husband and the nurse, I started to everything started to go black, and I felt like I was going to collapse, and then really bad nausea kicked in. So I kind of slid down the wall as they're standing there talking. My husband grabbed hold of me, picked me back up, and then yeah, I was on the verge of vomiting. So the nurse rushed, got a wheelchair for me, and then my husband wheeled me down towards the corridor to exit the hospital. I didn't make it out of the hospital before vomiting. Yeah, I vomited lots, and in the vomit was quite a bit of blood. But obviously that's normal because I've been swallowing the blood down from the operation, so that was completely fine. And then I got home, didn't feel any more sickness. The nausea completely went away. So the nurse was right. It was probably just best to get that initial vomit out rather than try and suppress it. And then obviously, yeah, day one, I was having ice packs on the front. I ordered these ice packs from Amazon. You can get them from Amazon. It's like, I think I paid like £6 for it, but it's quite handy. I didn't use it after day one though. I didn't really need it. I didn't have any swelling, but I used it initially after I came back home, and obviously just tons and tons of ice water. I ate like 3 ice lollies in the matter of like 3 hours. Yeah, ice lollies was my saviour until day 3. I slept pretty well for 3 days. Day 1, day 2, day 3. So after day 3, it started to get excruciating. Before day 3, it was very painful, very uncomfortable, but I would say it was bearable. And sleeping wasn't that much of an issue, apart from the fact where I was waking up with like a drowning sensation, where all of your saliva kind of gets thicker and kind of just comes constantly, and you constantly feel like you have to swallow every couple of seconds. I guess it's your mouth's way of protecting you. But yeah, obviously you fall asleep, you forget to swallow, and then it kind of pulls in the back of your throat. So I woke up, I think on night 2, panicking, feeling like I was drowning. I started to choke, which isn't ideal because obviously coughing and everything is just going to make it worse. But I started to choke. Yeah, I was really panicking. And then obviously after drinking lots of water, that kind of passed. It happened again on night 3 as well, same thing, feeling like I was drowning. All the saliva poured to the back of my throat as I was sleeping, choking. This exactly the same experience. By day 4, it was getting really, really like just indescribable. Like I've never experienced such bad throat and ear pain. So by day 4, the ear pain was just absolutely insane. So the ear pain is called referred pain, and it's just because the same nerve that was connected to your tonsil is also connected to your ears. So I didn't actually have any ear pain up until day 3, but after day 3, the ear pain was out of this world. I was curled up on the sofa in the fetal position with the blanket over my face, covering my ears, this ear particularly, because this ear pain wasn't that bad, but this one was insane. And I would stay like that until the ear pain would subside, which took about an hour. So I was in the fetal position like a baby with a blanket over my face for like an hour every single morning. And then during the day, it was kind of more bearable, but I was taking painkillers round the clock every 4 hours. And then that started not to work anymore. So I was like, oh, what am I going to do now? So then I switched to taking them every 3 hours. Just a disclaimer, wouldn't recommend. Follow your doctor's advice. But for me personally, the pain was getting so out of control that every 4 hours just was not touching it. If I would have waited to the 4 hour mark, I would have been like rolling around on the floor. There is no way I could have gone 4 hours. So I was taking ibuprofen and paracetamol every 3 hours, which seemed to do a better job than the 4 hours was. Sorry, just need a drink. After 14 days, my throat still isn't normal, but it's getting there. So yeah, so the morning and the night time was the worst. During the day, I would say it was more bearable. Eating, I was eating a normal diet because my surgeon literally was like, if you don't eat a normal diet, the risk of infection, the risk of bleeding is gonna go up so much more than if you just try and eat what you would normally eat, except spicy food, boiling hot food and boiling hot drink. Wait for everything to cool down and then eat it. You can mix soft with like more solid food. A mix is fine, but not just completely soft, because that's not going to help. Apparently if you eat normal food, then it cleans the back of your throat. It's really difficult trying to eat normal food. I mean, at one point it just wasn't going down. Like I just couldn't swallow it. My throat was so sore, so swollen. I could barely even swallow my tablets to take those, let alone like have a normal diet. So what I did for the first 3 days, I was eating mashed potatoes and like fish, and I was like kind of mashing the fish in with the mashed potatoes. I survived on that for 3 days, and then also I was covering everything with gravy. So after the 3 days, I made a really nice homemade chicken pie, and I just smothered the whole thing with bundles of gravy. So yeah, I made meat pie, I had like chicken nuggets, chips and gravy. So I smothered the chips and the chicken nuggets in gravy until everything was really soggy, and I ate that. And then I started to slowly kind of introduce more harder food. So like I would have toast, which, oh my God, the first the first bite of that toast. I ate toast on the morning of day 4. Yeah, day 4 or day 5, I can't quite remember. It was excruciating, but I just kept saying to myself, it's going to clean the back of your throat, it's going to reduce the risk of infection and bleeding. Come on, Alexandra, you can do this. So yeah, I was eating toast, and for dinner, yeah, just carried on with weird food combinations. I don't know, but it was just getting me through. I was putting gravy on literally everything, but by day 6, I'd kind of lessened the gravy. I was eating like normal, like chicken and stuff like that, without any sauce on it, and just kind of pushing it down with the help of cold water. So yeah, my diet was pretty much the same, apart from those 3 days and apart from putting gravy on most of my food. But I did lessen the gravy after day 5, and was eating pretty much completely normally after day 5. So by day 6, so day 5, day 6 and day 7, those 3 days was the most painfulest days out of the whole experience. My surgeon did say that around day 3, he said day 3 to day 7, I'm going to have a peak, which was quite accurate because day 3 was actually okay for me. Day 4, I started to get a little bit worse. Day 5 was my peak. So day 5 to day 7, even day 8, I would say was the most painfulest. Those days were the mornings and the nights were particularly very excruciating, where I was like curled up in a ball, felt like I couldn't really do much, was feeling incredibly sorry for myself, was on the verge of tears. I was just feeling like I was just in so much pain. That's just my experience. Some people have just discomfort, but I know majority of people that I've spoken to, that I've seen online, have had a lot of pain after tonsillectomy. So yeah, it wasn't anything, that I wasn't prepared for, although you can never be that prepared unless you actually face it in the moment. And yeah, I wasn't quite prepared for just how painful it was going to be. So I got through it doing the method of, like I said, taking my pain medication every 3 hours instead of every 4 hours, lots of drinking constantly. Another tip is, so all night long I was waking up so it started off every 45 minutes, and then I dropped it down to every 30 minutes, and then eventually every 25 minutes to wake up for water. So in the first 3 days, it was 45-minute timer all throughout the night to drink water. Then on day 5, day 6, it was 30 minutes. And then after that, I dropped it down to 25 minutes because I just felt like my throat was just getting more and more dry every night. Even now, it gets so dry. So every 25 minutes, I would wake up, which is a bit of a bummer when you want to sleep, when you're so tired, so exhausted from the pain, you just want to sleep. But unfortunately, you're not going to get that much sleep. You have to wake up to drink. If you don't, the scabs in the back of your throat is going to get so dry, so painful, that it's going to be so hard to swallow. So I would highly recommend you setting a timer for whatever is good for you. Try a few times, different times like I did, and see what's more comfortable. But definitely wake up to drink. It's going to be a lifesaver to get you through the night. Also, all through the night, I was taking painkillers, which was making me feel a bit sick. But the hospital gave me this tablet, which kind of, when you're taking ibuprofen, it kind of protects your stomach from, getting any ulcers or anything like that. So, because obviously they know you're going to have to take a lot of painkillers, the hospital will probably give you something to coat your tummy, just so you don't get, tummy cramps or upset tummy or diarrhea or anything like that. So yeah, by day 8, I had my first, I went out for the first time, but only in the car. I didn't get out. So my husband took me for a drive to the countryside on day 8, and again I took this with me, obviously, plus another water bottle as well, plus my painkillers, my throat spray, Difflam's throat spray, which you can take every 90 minutes, which I took all the way through. I'm still taking my Difflam spray, which they give you at the hospital. And by day 9, I was feeling like I was kind of getting back to normal a little bit more. I'm currently on day 14, I believe, so it's exactly 2 weeks. Day 10, day 11, day 12 felt pretty much the same really, but now I'm starting to notice a big difference. So I went last night, I just woke up twice to drink. There was no timer, kind of no need to drink every, at a set time. I slept pretty much all the way through, apart from waking up once to take painkillers and waking up twice to drink water. Also, I got sent home with antibiotics. So the hospital will send you home probably with antibiotics to prevent the risk of infection. You get sent home with a week's course. So obviously I completed that course. My scabs have completely come off now. They completely came off around day 11, but they can come off around day 5 to day 10. I had no bleeding whatsoever. I would taste the odd amount of blood in my mouth, very tiny amount, around like day 3 to day 5. I was tasting a little bit of blood, but whenever I would check, there was no blood at the back of my throat. My scabs hadn't come off or anything, but there was definitely like a metallic irony taste. So I just presume that might have been a tiny little bit of blood, but I didn't hemorrhage, I didn't actively bleed, thank God. No infection. I did think that I was getting infection around day 6, just because the pain was out of this world, and the back of my throat started to look incredibly red. Now, when I looked it up on the internet, it said the signs of infection after tonsillectomy is more redness than usual, more pain that's just not getting better but is getting worse. So that was definitely me. A fever. I didn't have a fever, but I was having these really bad cold sweats to the point where I was just drenched in sweat, but I wasn't hot. I wasn't feverish. I was just like, it was just a cold sweat, but really bad. So I did think that I might have to go back to the hospital, but luckily around day 7, day 8, the back of my throat started to look really good, and the sweat started to ease off. The pain started to get a little bit better. So then I was like, okay, I don't really need to go to the hospital for this. But yeah, just look out for infection signs, which is a fever, more redness than usual in the back of your throat, bleeding, and the pain just getting so excruciating that you can't even swallow water. Then go to your A&E. But yeah, the back of my throat at the moment, all the scabs are off. It just looks very red. That's probably going to heal in the next week or so. My throat is still dry. I'm still taking paracetamol, but paracetamol only. I'm not taking ibuprofen anymore. I'll probably be taking paracetamol for the next week, I presume, just by how my throat is feeling. But you never know, could, get instantly much better in a few days. I'm still having to drink loads and loads of water. Like I said, my throat is still incredibly dry, still uncomfortable, but overall much better than what it was. I really needed this procedure. There was no way I could get away with not having it. I did try to for 1 year. I really didn't want this operation because I was aware of how painful it is in adults. the risks and the complications are much more, is much higher in adults. The risk of hemorrhaging, bleeding, of infection, all of that stuff is much higher in adults. I just felt like it was a little bit unnecessary at the time, but when I went for my recent consultation with the consultant and she looked at the back of my throat, this right tonsil was so enlarged. She was like, there is no way you can leave that. Like, there is no way we can leave your tonsils in that position, in that state. So they biopsied my tonsils as well, just to check for cancer, just in case, because they were very enlarged. Plus the glands all in my neck are also swollen. So that was also a cause for concern, because they said it was probably because of the constant tonsillitis and my glands just didn't go back down, my tonsils just didn't go back down. But still, they sent my tonsils for biopsy just to make sure. And I need to call, I think, the hospital next week to see if the results have come back for that. But I'm thinking that everything is fine, you know, because I don't have any other symptoms. So yeah, I would say that my personal experience was very, very painful. The most painfulest operation I've had, and bear in mind, I've had abdominal surgeries, which I didn't think could get any more painful than recovering from an abdominal surgery, but actually this was more painful than my abdominal surgery recovery. Again, just my experience doesn't mean your experience is going to be the same, doesn't mean it's going to be as painful for you, but just keep in mind, if you're going to have this surgery, it is going to be very painful, very uncomfortable, and you are going to get worse before you get better. There is a peak, so the doctors say between day 5 to day 3 to day 7 is kind of the peak zone. For me, my peak came at day 5 to around about day 8. That was my peak. So everybody's different. Everybody's going to peak at different times as well. But yeah, just look out for the main signs of bleeding, the main signs of infection, which I just said. And keep up with your pain meds, keep up with drinking loads of water. Even if it hurts, you have to drink regularly, very regularly. Set a timer for the night time, so that your throat don't get dry, so that you can actually swallow in the morning. And try and eat a normal diet. Eat as much as you possibly can, because the less you eat, the less you drink, the more chances you're going to get an infection, the more chances, you know, the pain is going to be worse, the more chances you will bleed. So those things are very, very important. Other than that, just relax, chill out. You know, I was on the sofa. I chose to be on the sofa the whole time. I didn't want to go to bed. I don't know, that for me is like a childhood habit, because when I was a kid and I was sick, I wasn't allowed to sleep in my bed because they wanted to like keep an eye on me and make sure I was okay. So I had to sleep on the sofa until I got better. So for me, that's kind of just like a habit that I can't break. So whenever I'm really poorly, I always sleep on the sofa. But what I did was I took my pillows from the bed, put them on the sofa, underneath that cushions, because you have to be quite high up because of the fact that the saliva can pull in the back of your throat and you get that drowning feeling. It's much better if you stock up on lots of pillows. So I had pillows, lots of pillows, blankets on the sofa. I was very, very comfortable. Very happy to be on the sofa, because, you know, don't like to be on the bed when I'm ill. And yeah, I was just relaxing, chilling. My husband was off work for 2 weeks looking after me. And yeah, just doing the school run for me and all of that stuff. Didn't have to worry about anything. So yeah, that was really nice. I had like a whole chilling session for 2 weeks. But yeah, it was a very painful 2 weeks for me. But now I'm definitely on the mend, feeling much better. I'm back, my husband's back to work. I'm back to doing my normal activities. Actually, 2 days ago we went to the seaside as well, just to get some nice sea breeze, sea air fresh air. That was my second time going out, but like properly out, because before that I was just in the car going for drives, country drives, but that was my first time actually going out. They do recommend not going out for 2 weeks in crowds because of the risk of catching something, so I definitely stuck to that. I didn't meet up with anyone, I isolated. My husband wasn't at work, so he was at home as well, isolating with me. I just was really sure that I didn't want to risk getting anything on top of, you know, my open wounds. So yeah, now I'm just back to my normal routine, school run, doing my thing, going out. I'm still kind of taking it easy. I do still feel not exactly myself. I'm walking a little bit slower. Normally I exercise loads. I do lots of walking, up to 2 hours every day. Exercise, bike, all of the rest of it. I really like to keep myself fit, but I won't be exercising properly until probably next week. I really want to give my body that time to adjust, to rest, and to heal, because obviously the back of my throat still isn't healed. The scabs come off, but it leaves your throat completely red, raw and bare. So yeah, you really do have to kind of look after your throat and you know, do the appropriate steps that's right for you. So yeah, that's my little summary of how it went for me. I wish I could have vlogged, you know, day to day. It would have been better than having to explain it all. But yeah, you get to a point where I couldn't speak either. I forgot to mention that. It's kind of a major point. I couldn't speak for 10 days, so I was using the text-to-speak app to communicate with my husband and my son. So the first few days, literally I was mute, nothing was coming out, even though I was trying to speak, nothing, like I didn't have a voice. And then after that, it became so excruciating to talk, I just didn't bother. I'm like, I'm just gonna rest my voice. Why am I forcing myself to talk when I'm already in so much pain as it is? So I got the text-to-speak app, which is really handy if you're also suffering from the same thing. So you type in and then it just speaks for you. So I was just basically relying on that, and doing lots of hand gestures and like sign language and stuff. But yeah, so yeah, I couldn't speak for a full 10 days. So I'm speaking like softer than usual. Can't speak very loud, can't speak for very long durations. My throat gets very dry, very uncomfortable, constantly attached to my water bottle to keep drinking as I'm talking. But yeah, definitely on the mend, definitely feeling better. And yeah, if you need this done, go and get it done. It's for the rest of your life. No more tonsillitis, no more constant infections. It's definitely worth it. And yeah, I'm just gonna see now, like when winter time comes, when all the bugs come, when I normally would get tonsillitis, how is that going to play out? How often am I going to get sick now? How, you know, am I going to get throat infections? We'll see how it goes. But yeah, this is just my experience. Anybody out there that's about to get their tonsils removed, I wish you the very best of luck. I hope it all goes well for you. And yeah, thank you for watching. I will see you all in the next one.